Hello everyone, my name is Luqman bin Mazlan. I'm a orthopedic trainee at Hospital Chancellor Tunku Mukhris, University Kuala Malaysia. We would like to share a rare case of bilateral tibial tuberosity periosteal sleeve fracture in adolescent. A 13-year-old boy with no medical illness presented to us with pain at bilateral knees while playing indoor football. It occurred during a sudden sprint. He heard a crack-like sound from bilateral knees. He was initially able to stand up and walk a few steps. However, due to the pain, he was unable to breathe bear. He was immediately brought to our center for further assessment, and it reveals that the bruises at the infrapatellar region, effusion at the patellar recess, and loss of accessor mechanisms of both knees. Figure 1 shows clinical picture during patient presentation. There were infrapatellar bruises with swelling at the patellar recess. Figure 2A and Figure 2B shows lateral view of bilateral knees, showing a displaced fragments of tibial tuberosity avulsion fracture. We decided for open reduction and surgical fixation for the injury. So the right knee intraoperative finding, there's a complete avulsion of the patellar tendon, and the patellar tendon was repaired the tibial tuberosity with pull-through suture method. The fragment was too small for us to screw fix. And at the left knee, patellar tendon was still attached at tibial tuberosity, but it was stretched and became elongated. There were 2 avulsed fragments found, however, one is big enough for us to screw fix. Figure 3A shows total avulsion of patellar tendon at right knee, and Figure 3B shows the elongated patellar tendon at the left knee. Immediate post-operative, patient was put on cylinder slab at full extension to protect the surgical fixation, and later the slabs were replaced with hinged knee brace lock at 5 degrees flexion. Patient was able to be discharged with recliner wheelchair for mobilization at home. At 2 weeks post-op, the wound was healed well. He was allowed 0 to 30 degrees knee range of motion, and he was allowed ambulation with crutches. And at 6 weeks post-operative, he was allowed 0 to 90 degrees of knee range of motion, and physiotherapy was prescribed for the patient for muscle strengthening, focusing on quadriceps strengthening and also range of motion exercise. At 3 months post-op, hinge brace was removed, was allowed full range of motion of bilateral knees with full weight bearing ambulation. And at 6 months post-op, patient was able to ambulate without aid, range of motion of knees restored, extensor mechanism restored, and he was able to return to daily activity. There was no pain, and he was able to return to school, and he was able to carry out his daily activity. This figure 4A, 4B, and 4C shows post-operative 6 months. Figure 4A shows patient able to stand up without aid. Figure 4B and 4C showing that the both knee extensor mechanism has been restored. To discuss on the mechanism of injury, Davidson and Letts in 2002 has well described the mechanism of injury. It is due to substantial tensile force acting on patellar ligament secondary to forced knee flexion with concurrent quadriceps contraction, or alternatively, it can also be due to forceful knee extensor contraction against the fixed tibia. As for our patient, it occurs during the sprinting, the concurrent quadriceps contraction with forced knee flexion, causing increase in tensile force at patella, producing the avulsion pattern injury of the tibial tuberosity. And for the discussion, according to Cole et al. 2020, rare occurrence of this type of injury is about 0.4 to 2.7% in pediatric fracture and less than 1% in physical fracture. As compared to unilateral, this bilateral injury, higher complication rates. Kushar et al. 2020 reported 32.4% complication rates with formerly heart removal and wound incidents. We tend to be more cautious with a failure of fixation. So gradual increment of the knee flexion was allowed during each follow-up, and with our protocol, we managed to get a good clinical outcome for the patient and no complication occurred, and patient satisfied with the treatment. Thank you.